Hello, everyone. Welcome to Insights of MASLD and MASH Community Network. My name is Edith Johannes. I am a nurse practitioner at UCLA Health in Los Angeles. I have had the opportunity to work with chronic liver disease patients and liver transplants since 2007. Today's insight is to answer a common question about MASLD and MASH from primary care providers. A question that comes to mind is about weight loss. Specifically, how much weight loss is necessary to have a positive effect on MASLD or MASH? Sounds straightforward, right? Well, as everything else with MASLD and MASH, the answer is anything but simple. Before I give you that magic number, let's highlight a few points. Weight loss benefits extend beyond the liver by improving blood sugars, blood pressure, and cholesterol levels. In the liver, weight loss decreases steatosis. It helps with the amount of fat deposited in the liver to decrease. Weight loss decreases inflammation, which is the key feature causing progression of disease to fibrosis and fibrosis to cirrhosis. Weight loss improves fibrosis and can potentially reverse it. That's an important thing to remember. Weight loss is difficult to attain and sustain long-term. Therefore, combining lifestyle changes with medications such as Resmetirom can be indicated for better outcomes. Now, for that magic number I alluded to, the amount of weight loss positively impacts MASH and MASLD. The answer is greater than 10% weight loss. This should be the goal. Greater than 10% weight loss resulted in 100% of steatosis improvement. This is amazing because, when was the last time as providers that an intervention helped 100% of the time? What's even more impressive is that greater than 10% of the weight loss resulted in MASH resolution in 90% of the people, reverted fibrosis in at least one stage in 81% of people. It is important to know that MASH resolution rates decrease if there is a diagnosis of diabetes and the patients are older, but it is definitely helpful. 10% doesn't sound like a lot. However, when we're talking about weight loss, it is pretty high. It is difficult to do. Anyone on this journey knows that, and their efforts should be recognized along with the positive physiological changes happening. For those MASLD and MASH patients who do not achieve greater than 10% weight loss, remember the following. 7 to 10% of weight loss can also resolve MASH in up to 60% of people. Absence of hepatocellular ballooning was noted histologically in liver biopsies. In people who only lose 5 to 7%, there was a reduction in lipid content, meaning steatosis, in 65% of patients. And for those who lose 5%, there is still a lot of positive effects in adipose tissue and hepatic tissue and the glucose uptake. So to highlight, understanding that even a small percent of weight loss has benefits is encouraging. But what's more astounding is that even zero weight loss has benefits. Let me explain. Studies show that people who adopt a regular exercise routine, 30 minutes a day for 5 days a week, and or change the composition of the food they consume, less carbohydrates, for example, will have improvement in steatosis. To summarize, in patients with MASLD and MASH, weight loss should be a focus of management and the goal being greater than 10% of weight lost. Some will require weight loss strategies beyond exercise and nutrition, like GLP-1s and bariatric surgery, and some will require adjunct pharmacotherapy like Resmetirom to treat MASH. But let's continue to encourage patients to change lifestyles towards healthier eating, exercising, because research shows that there is positive physiological changes even when the scale won't budge. Thank you so much for listening to today's insight and hope to see you soon in the MASLD MASH Community Network.